Okay, guys, focus of your discussion is nurse-patient relationship, and then the other responsibilities also that the nurse needs when they are while we are encountering bioethical concerns in the clinical setting. Now, on the nurse and patient relationship, I've used one term there to signify this kind of relationship. What is the term, guys? That tells us that whatever the patient will divulge to the nurse, that should be kept by the nurse to herself. What kind of communication is that? What kind of communication is it? Sige na. What do you call that kind of communication that happens between the nurse and the patient? That whatever the nurse will know of about the patient would not be divulged to others and should not be divulged to others. What do you call that kind of communication? Students, what do you call that kind of communication? Starts with letter P. Guys, are you there? Sige na. What do you call the communication wherein it
Privacy.
occurs? Again?
Privacy.
Privacy, I'll take the word, but it's not the answer. It's the kind of communication between the patient and the nurse, wherein the nurse must not disclose the information gathered. Let's give credit to that. Okay. Guys, what do you call that? Students, I'm referring to your privilege communication. I'm referring to the term privilege communication. Kindly take note of that. Now, what do I mean, class, by privilege communication? It means that whatever the nurse will be gathering during the interview, the nurse must hold it in secrecy, the nurse must hold it in confidentiality, and must not share it to others unless known by the patient, because it is considered to be a privileged communication. In other words, in your own words, we can say as it is a privilegio. Okay? It is a privilege for you to hear this information, and because it is a privilege, it is not something that is accorded to the public. It is not something that is shared to the public, but something that is only kept to bare minimum. Okay? It is only shared to minimal number of people. Now look at that one, professional secrets about the patient and family that is personal in nature and that the nurse must decide whether or not to disclose to the physician. Class, for example, I will tell you, for example, Sheena is my nurse and I will tell Sheena, you know what, Sheena, last year I got sick, I had tonsillitis. Does Sheena need to inform other nurses in the hospital about my tonsillitis last year? Do you need to do that? Does Sheena need to inform all other nurses in the hospital? No. Okay, that information must remain to Sheena and only on my records. It does not need to be shared to others. Okay, for example, if I will tell Princess and then tell Princess, you know what, Princess, I had multiple sex partners born up on the wood. Okay, class, for example, I will say, Princess, I had multiple sex partners, and I'm telling you as your patient. Is Princess supposed to share that to other people? No, also, because that information, class, needs to be reflected only in my records. And those class needs to be kept in private. Excuse me. So you need to remember that in privileged communication, these are information, students, that must be kept from others and must be only discussed by the nurse and then the patient and others involved in the care of your patient. Now, let's say, for example, Cherise, okay, or let's say, for example, Cherise encountered a patient with HIV. You know that HIV/AIDS is a sensitive issue in our healthcare system. Now, Cherise, let's say, for example, somebody has HIV/AIDS. Do you need to inform the hospital that this patient has HIV/AIDS? Cherise, do I need to inform the hospital that this patient has HIV/AIDS?
Yes, sir.
Okay, if you get to choose, Cherise, whom do you think you inform? All the hospital personnel or all the personnel who will just handle the patient? Will you inform?
Will handle the patient, sir.
Okay. So in that case, class, the one that needs to be informed is the one that will be handling the patient only. You don't need to inform everybody in the hospital because who knows if this person is related to them, who knows if this person, class, might have some bearing to their relationships. So it's not on your part to inform them. but you need to inform all the nurses who will be taking care of this patient in the hospital. So for example, Cherise, you are taking care of this patient with HIV in the hospital, and then the patient will be undergoing surgery. And then Roxanne May is the nurse in the surgery department. So Cherise, you need to endorse to Roxanne. Hey Roxanne, this patient has HIV. Because you know that Roxanne will be handling the blood of this patient during surgery. And you need Roxanne to take additional precautions also because you know that HIV could be spread through blood. Okay, that's one way, class, no? That's one way for you to keep your nurse patient, to keep your privileged communication to your patient. Another example for this one, class, is that in particular for your HIV/AIDS patient, what we are doing actually to them is to assign codes. We are assigning codes to our HIV/AIDS patient. For example, if you will go to tertiary hospitals, especially government hospitals, these patient students with HIV/AIDS would not usually have their name on the chart. They would not have their name on the chart. So what actually happens on the chart is that it's just the code that is being placed. So what do you mean by code, class? No? Instead of, for example, of writing Juan de la Cruz, what we write is PHAP, PHAP 121. Okay, class, what is PHAP 121? So that would mean that that is a patient having HIV, something like that. And then if you are addressing the patient, for example, if you will give medications to this patient, our routine, if you already have your pharmacology, our routine when we administer medications is that we ask the name of the patient. But then, class, in this case, you can ask for the code of the patient. So instead of saying, sir, can you please state your name? You can just say, sir, can you please state your code? And then, class, they would say, I am PHAP 121. Then you would know that he is the person that you would be giving the medication into. Why? That is also, class, to protect those people with HIV/AIDS, and that's to encourage them to avail of treatment. Why? Oftentimes, class, they are not going to the hospitals because they are afraid to be judged. They're also not going, class, to the healthcare facility because they don't want others to know that they have HIV. For example, in Western Visayas Medical Center here in Iloilo, you can notice that there are patients from other provinces who are going here because they don't want to avail of the services in their own provinces because they don't want to be judged. Okay? So for example, imagine they're even from Cebu, they would go to Iloilo just to avail of the treatment that is for free. And come to think of it, these treatments are also available in their respective provinces, but they just don't want their names to be included there. Okay, so we respect that. That's why, class, you have the term privileged communication. Now, a very particular example, class, for your exception in privileged communication is what you call your risk for suicide. So once your patient students would express the risk for suicide, okay, class, your privileged communication is already stopped. So class, once your patient would say there is a risk for suicide, privileged communication is already halted. Okay, what do we mean by that? If there is a risk for suicide, you need to inform the physician. You need to inform fellow nurses. You also need to inform security guard because after all, you would want to protect the life of the patient. You would want to protect the life of the patient. So again, we always maintain privacy and confidentiality unless that this information would be needed to prevent loss of life. Okay, unless this information is needed to prevent loss of life. One example perhaps that I can tell you is this. No? For example, a patient is psychotic. Okay, psychotic, meaning he's not in his proper state of mind. And then the patient absconded from the hospital. When I say, class, absconded, parang illegally lumabas siya. Wala pa siyang clearance, wala pa siyang discharge order, tumakas siya. If that happens, students, no, and then for example, that patient told you, okay, for example, yesterday the patient told you, by the time I will go out of this hospital, I will kill Alex. Okay, kung sino man si Alex na yan, baka ex niya, baka kasama niya kung saan-saan, na ba naging enemy niya. But once he mentioned that, and then for example, the patient went out of the hospital, the patient absconded. Can I inform the public police that a patient is threatening the life of Alex? Do I need to inform the police or shall I keep it to myself kasi privileged communication siya?
Inform, sir.
Okay, you need to inform the police. Okay? Plus, that is threat already to the life of an individual. And with that threat to the life of the individual, you already know that there needs something to be done. How about if that patient will indeed pursue Alex and then kill Alex? So you will be guilty of taking the life of Alex by not informing the concerned officers. Okay, so that's one way, no? That's one way for us to say that, okay, by privilege communication. So what do we do then? Because the purpose of privilege communication, guys, is for you to gain the trust of your patient. At the start of your interview, you would tell your patient, okay, sir, good afternoon. I am your nurse for today. I will be taking care of you, for example, from 3 p.m. to 11 p.m. Sir, for us to have an appropriate care and for us to deliver the best care that you deserve, we need to know more information about you. And then you would go saying, class, rest assured, sir, that I will not be divulging. I will not be telling this information to anybody. Now, when the time comes that you know that the patient has a risk for suicide, you need to inform them this. We say something like this. Sir, I'm so sorry. I understand I've mentioned about privacy and confidentiality earlier, but for this information, I need to share this to authorities. For this information, I need to inform your physician. Okay? So class, those are exceptions for your privileged communication. So try to remember that. That's why it's enclosed under nurse-patient relationship. Then you also have class your duties to yourself. So what do you mean by nurse to self? No? So these are, by the way, class the groups to whom the nurses has ethical responsibilities. Now, your duty to self is to improve your knowledge, attitude, and practices. Okay, so class, you need to improve your knowledge. Let's place it at KSA. Knowledge, skills, and attitude. That's your responsibility as a nurse. You have a duty to yourself to improve your knowledge, then class your skills, then your attitude. These three are all important for you to become an effective nurse. Now, what do we mean by improving your knowledge? As a nurse class, it is not possible for you to survive practice by just focusing on what you learned. Instead, you need to learn more. That's the message. You need to learn more. And how do you learn more, guys? What will you be attending? For example, you're already a graduate. You're already a graduate nurse and you already have your license. Okay? What will be your intervention, guys, to ensure that you will be updated? Sige na, what will be your intervention that you will be updated? What do you think? What will you do? Diba sabi, improve her mind by reading the best books. Other than reading the best books, what do you think will you do as a nurse for you to improve your knowledge? Sige na, what will you do to improve your knowledge, guys? I'm waiting. Chat. What are the things that you can do to improve your knowledge as a nurse?
Listen, sir.
Listen. Listen to what?
Listen to ano, sir, like sa instructions, sir, and then sa mga studies.
Okay, very good. So one thing plus that you can do is to listen. You can attend actually seminars. You can attend workshop. And then you mentioned studies. So that goes back to having researches. Okay, that's one way class to improve your knowledge. Okay, now, oftentimes in our profession, we refer to that one as your CPD. We refer to that one as your continuing professional development. Okay, we refer to that one as your continuing professional development. Plus, your continuing professional development allows you to gain more knowledge, to gain more insight about the profession. Okay, so as a nurse, it is your responsibility to do that. It is not possible for you guys to just keep on practicing what you have been doing in the past because you think it is effective. You need to practice things because it is based on research. You need to practice things because the latest updates class would be doing that. Okay, seminars, training, and specialization, good, very good inputs. Now, going out and visiting friends class, this is actually what you refer to as your mental hygiene. This goes back to what you refer to as your mental hygiene. In other words, as a nurse, you have a responsibility, class, to promote good attitude, and that is by socialization. Okay, imagine this list that was given in the past. Then class, attending theater twice a month. That was also one of the suggestions that they have. And the purpose of that is also leading towards mental hygiene. Okay, the purpose of that is also leading towards mental hygiene. Okay, kindly take note of that. Now, other than that, students, you also have your other duties to self. One is hot bath in the evening for cleanliness and to aid in sleep. Take note of that. This is actually proven by science that warm bath could actually help you sleep. Then, of course, brushing of your teeth, class, to maintain hygiene, regular meals, then regular amount of well-organized recreation, then 2 weeks of vacation, ongoing, reading and attending alumni association meetings. Now, if I would look at these students, this actually varies between organizations. 2 weeks of vacation in some organizations, class, it's 15 working days. In other organizations, class, if you are doing studies, you might be exempted and then you might have additional pay benefits. And then class, for the alumni association meetings, so some organization does have alumni association while others do not. So it varies between organizations. But one thing, class, that this is telling us is that as a nurse, you have a duty to yourself to do self-care. You have a duty to yourself, again, class, to do self-care. Take note, we are talking here of groups that could be possibly helped by a nurse. And this time, class, the group that we are talking about is ourselves as nurses. So what do we mean by this? As a nurse, class, you need to be able to take care of yourself. That includes, class, your hygiene. That includes your lifestyle. That includes your diet. Because according to Isabel Robb, it's your responsibility to the community to take care of yourself for you to be able to deliver the effective nursing care that the community deserves. Okay, that's according, class, to your self-care. So, as you can see here, as you can see, it does not need really to be 2 movies in a week or in a month. Sometimes, class, it could be 2 days that you're going out with friends just for you to socialize. And then, class, it would mean also that you are attending meetings. So we are reminded that these are all our responsibilities. Now, the nurse-to-nurse relationship. The nurse-to-nurse relationship, class, is very important because there needs to be harmony between nurses. We oftentimes refer to this as your esprit de corps. Okay, we refer to this one, class, as esprit de corps, or basically teamwork. If you are into ROTC, I think you realize what teamwork, what's the value of esprit de corps is. Now, class, what do we mean by true harmony among nurses? It is unethical for us to talk ill about our companions. Now, for example, if I don't like, example only, if I don't like Dayan, and then I will be talking around, you know what, Marian, I don't like Dayan. You know what, Brianna, I hate Dayan. She's a very bad nurse. You know what, Carmela, I hate Dayan. The way she works is blah, blah, blah. Okay? It does me no good also to talk ill about Dayan because a nurse is responsible to his fellow nurses. If I have a problem with Dayan, the best thing actually that I should do is confront Dayan and tell Dayan, hi Dayan, I think I don't like what you did this morning. Hey Dayan, I don't like what you did with our patient yesterday. Okay, rather than for me to talk Dayan, okay, and tell others how bad Dayan is, I'd rather talk to Dayan directly because that is how a nurse is expected to act. That is how a nurse is expected to work. Okay? Take note that the tone of school and the tone of the hospital, okay, is called already the moral environment of education or practices. What do I mean by that? If, for example, what I did earlier with Dayan would persist in the entire organization, the tendency is that the tone of our hospital becomes toxic. The tone of our hospital becomes unfriendly. The tone of our hospital becomes stressful. Okay, if I'm doing that to Dayan, okay, I might be doing it also to Roma. And then I would be like, and others would be like saying, oh no, we are here in this hospital again. Okay, it's my time to work again. It's very difficult to work with people here. Okay, so again, class, nurse-to-nurse relationship reminds us that as nurses, we should accord respect to one another. We should have respect to one another. We should do respect to one another, because it is only through respect that we will be able to protect our profession also. Now, sir, for example, no, earlier in the example, if Diane, for example, did not listen to me, or for example, Diane took it negatively, okay? Kumbaga, I approached Diane and then said, Diane, I'm so sorry to say, tell you this, but I don't like what happened yesterday. What about Diane would be resistant? And what about if Diane would not listen to me? Who's the next best person to approach? Is it about time for me to rant about Diane to my other colleagues, or will I talk to my head nurse? Will I rant or talk to head nurse? Okay, the best next move is for you to talk to your head nurse. Okay, that's the time. Okay, you can tell the head nurse, Ma'am, you know what I've noticed? I have had a lot of disagreement with this nurse. Okay, can you talk to her? Because this is my problem to her. And then plus the head nurse, if the head nurse is prudent enough, the best thing that she would do is to lobby the two of you, okay, and to allow the two of you to talk to one another so that you will be able to come up with a very good suggestion as to how to deal with the problem at hand. Okay, so that's how you deal with true harmony. Now, plus, as mentioned here, it is hard to keep one's affection always within safe limits, yet it is the dangers to guard against these dangers when possible. Okay, again, class, you try to read by yourselves. It says there that, try to read by yourselves, guys. It is hard to keep one's affection always within safe limits, yet it is just well to know that friendship has dangers and to guard against these dangers whenever possible. Okay? Ano pong ibig sabihin yan? Bawal maglandi sa area. Okay, class, what's the meaning of that, guys? No? So, as nurses actually, and actually depending on your hospital policy, but oftentimes most of the hospitals would not allow lovers to work in the same area. Okay, there are also hospitals, class, that would not have nurses who are in relationship to be in the same department, to be in nursing department, for example. Why, class? Conflict of interest would ensue. A conflict of interest would ensue. Okay, for example, if si Juan nanliligaw pa lang kay Maria, tapos Maria committed the mistake, the tendency is for Juan to keep the mistake because Juan would want to protect the name of his love. Are you getting the point? So class, whenever love would come into picture, whenever love would come into picture, it might be disastrous at work. In the same way for friendship. So for example, if Carmela and I are very close to one another, we need to be able to have limits. We need to be able to set limits and then tell Carmela, Carmela, we are best friends outside the hospital, but inside the hospital, work is work. Okay, so Carmela, if ever you would commit a mistake, I will call your attention. If ever I committed a mistake, feel free also to call my attention because that is how we are supposed to work as friends. Okay? Now, class, that is very easily said than done. That is very easily said than done. Experience would tell me that it's very difficult to do that. Okay? So why? No, look at icons. Icons is reminding you that if ever there is affection, if ever, class, there is love, if ever there is intimate or close friendship between two co-workers, you need to be able to have the safe limits. Has safe limits, students. Okay? In the same way, guys, if you would look at it, the law actually does not prohibit a teacher to fall in love to a student and the student to fall in love to the teacher. But then, class, the conflict of interest would already come in once they are in love with one another. You know why? What's the tendency? The teacher might have the tendency to give high grades because he is in love with the students. And then the student, class, may have a tendency also to evaluate the teacher in a biased manner because they are in love with one another. Okay, so class, that's why if ever there's affection, it needs to be having limits. It needs to have limits. And you need to understand also why in the hospital. That's the reason why nurses who are in love with one another are usually not placed in a single area. Okay, because there might be conflict of interest and they might protect one another. and that might lead to the compromise of care that might be happening to the patients. Okay? So minsan kasi class, you will hear in the hospital, oh, hindi ni love supporter ng hospital. This hospital does not promote love or friendship. No, it is not like that. Please understand conflict of interest. Now, Rob also warned us, sentimental, intense personal friendship between nurses is a mistake and rarely productive of good. In some instances, they must be regarded as forms of perverted affection. They are always unhealthy. If I may comment, the sentence class may actually be far-flung, no, or far taken, but please take the word of advice. Let us not focus on the word their perverted affection, but take note that this may be unhealthy. Why we are discussing this, just for you to be aware that you need to be conscious of what you will be doing in the clinical area. Okay, for example, if you are courting your friend or your colleague in the clinical area, you should know that you should not be doing it during duty hours, or else it might be distracting your work. It might distract us the flow of work that is occurring. So that will make it unhealthy. Then other than that, the nurse, let's talk about the nurse and physician relationship. Plus, there are old adage here. So when I say old adage class, some of the ideas may be already old. Some of the ideas need to be updated, but take note, this is part of our studies in the history of ethics. Now look at that, nurse to patient, nurse to physician relationship. Okay, look at this. Rob explained that the nurse is not qualified to judge a physician. Kindly highlight that. Nurse is not qualified to judge a physician or to question his treatment, nor may she ever criticize the physician to the patient and the family. Important words. Nurses is not qualified to judge, especially class to criticize the physician to the patient or family. Okay? So class, that's why we do not undermine physicians, because after all, their training is different. Our training is also different. Then class, we also do not tell the family members, uy, don't go there. Pagkapangit-pangit na doktor yan, wag kang pumunta dyan. Okay, we do not tell bad words about doctors to our patients. Or we do not even say, ay naku ma'am, she was really wrong as a doctor. Her management to your child is wrong. You should remove her. No, that's not how we treat our doctors. Kindly take note of that. We do not do it in judgmental manner, or else class, we will be ruining the reputation of the doctor. And then other than that, we are also ruining the dignity of our profession. But, okay, I would want to give a but. At present class, you are already free to question the treatment of the doctor. You could already question the treatment of the doctor. But class, whenever you are questioning the treatment of the doctor, do it with respect. Class, if ever you are questioning the treatment of the doctor, you can do it with respect. Now, maybe a particular example that I can give you is in pharmacology. Let's say, for example, the physician have written epinephrine 10 milligrams IVTT. Now, if you are an experienced nurse and then if you have already knowledge in pharmacology, you would know that epinephrine IV is only given for cardiac arrest. And then plus epinephrine is given at 1 milligram and not 10 milligrams. It's given 1 milligram and not 10 milligrams. But you are reading this as 10 milligrams. What's the next best thing that you can do? Will you ask the doctor or will you just carry out the order? Will you ask the doctor first or carry out the doctor's order without asking?
Ask the doctor first
Ask
to
the doctor
verify
first.
the information.
This is the time class that you question his management. But class, when you question politely. Okay? Do not ask the question that, Doc, alam mo ba kung anong ginagawa mo? Okay? That's not how you ask the question, but instead you can say, Doc, good afternoon. Regarding patient Juan de la Cruz, I just would like to clarify if this is epinephrine 10 milligrams. For example, if the doctor will still say, yes, Doc, I'm so sorry but last time I experienced kasi, Doc, it's only 1 milligram. So are we sure, Doc, that this time it will be 10 milligrams? Okay, and then sometimes the doctor would say, ay, okay, nurse, I'm so sorry. That is 1 milligram. Kindly correct it and thank you for calling my attention. As nurses, let's remember that if the medication is wrongly ordered, for example, with the example I've given you, if you know that 10 milligrams is wrong, class, you are not supposed to give it to your patient. Because if you will be giving it to your patient, you will not be saved by the doctor's order. It is your responsibility as a nurse to countercheck doctor's order. And if there are errors, guys, in the doctor's order, you are not supposed to carry it out. Again, class, if there are errors in the doctor's order, you are not supposed to carry it out, or else you will be doing more harm to your patient. Okay, so that's one thing. Now, physician incompetence. When I say class incompetence, for example, you're seeing a doctor who does not know how to do his job. Okay, a doctor who does not know how to do his job. So class, if you already find out that a physician is incapable, you can always find some means to refuse to take charge of the nursing care of the patients. Okay, that's according to Rob on the old class, the recommendations. But once you have put herself under that physician, let her remain loyal and carry out his orders to the letter. I highlighted the word to put emphasis also that this is already being updated. Plus, yes, it is true, we do not discredit the physician. But if the physician class is incompetent, you need to call his attention. Okay, class, if the physician is already incompetent, you need to call his attention. Okay, you do not just remain loyal to him because he is a physician. Instead, class, if there is something wrong with the decisions that he is making, you need to call his attention. Why? After all, class, who's more important? Is it the patient or the physician? Who is the focus of our care? Patient or physician?
Patience.
Class,
Patient.
we are after the care of your patients. So class, whatever would happen, it is class the patient that remains to be the top priority. So if you have noticed, for example, that this doctor did something wrong to your patient, you can call her attention. And for example, you can tell her, Doc, I've noticed that your gloves is not worn properly. Or if you are doing it in front of the patient, maybe you can say, Doc, do you want additional gloves? At least class, that would give them the idea that, okay, there might be something wrong with my gloves. Okay, so class, if the physician is incompetent, call his attention. If he is not listening, talk to your head nurse. Your head nurse class can go to your chief nurse, and then the chief nurse could go to the medical director so that they can handle the concerns of the physician. Okay, we do not just become loyal to them and carry out their orders to the letter for the purpose of following them as physicians. We need to stick class to the moral values that, again, I said, the patient is the most important part of your care. Now, physician abuse. Class, remember in physician abuse or whatever kind of abuse in the hospital, I told you that you should have zero tolerance. Okay? The nurse class is not expected to put up to the unjust or rude behavior. What do I mean by that, class? We do not want that as nurses. For example, if the physician abused you, you would abuse him back. That's not how it works. Huh? Or for example, if the physician hit you, you would hit him back. That's not how it works, guys. So instead, as a nurse, you should practice zero tolerance. So again, as I mentioned, for example, sexual abuse. If somebody in the hospital, not only the physicians, if somebody in the hospital, for example, touch your private parts without your permission, you can tell him, hey, I don't want what you're doing. Okay, stop that, or else I will be calling security. Do not tolerate them doing it, because if you will be tolerating them, class, in doing it, they would repeatedly do it. They would think of two things, that one, you are weak, or second, you are afraid to report. Or third, by the way, okay, there's a third thing. They might think that you like what they are doing. That's why you are allowing them. So never, ever do it. Okay? So zero tolerance. For example, if you're doing the procedure and then a physician touch your butt, you inform the physician, Doc, I don't want them. Doc, I don't want to be touched there. Or Doc, I think you accidentally touched my butt. Okay? Express that so that they will know that you are aware and that you don't want that it to happen. Okay? So class, that does not, again, that does not only happen among physicians, but even class your patients and other healthcare professionals. So in your patient students, no, you cannot accuse them, especially if they have a mental health problem. You could not accuse them if they have a mental health problem. So for example, if a patient would approach you and then touch your boob, touch your breast, class, you could not say, hey, I will sue you in court. if he has a mental health problem. But one thing that you can do is that even if my mental health problem siya, class, you can actually say, sir, I don't want you to touch me here. Okay? Kahit may mental health problem siya, class, you need to tell him or her that you don't want to be touched there. Okay? So again, you do not punch them back, but instead you tell them that you don't like that behavior to occur. Now, class, any incompetence or appropriateness of medical care must come from the patient, not from the nurse. Goes without saying, students, that, for example, if the patient would complain, nurse, I don't want Dr. A. Dr. A is suplado, Dr. A does not know how to do things, Dr. A is not doing his job, Dr. A is not doing rounds. Class, can the patient change their doctors? Can the patient change their doctors? What do you think? Pwede ba? Okay, yes. Class, patient can change their doctors. So upon the request, students, the patient could actually change their doctors and then opt for another professional. But it should not be the nurse who would be recommending that. It should be the family who should verbalize them. As a nurse, class, you just participate or you just facilitate. Then, class, the nurse to society relationship. Class, this type of relationship is what we refer to as your social ethics. So, class, you have your citizenship, democratic ideals, democracy, and love for humanity. In other words, guys, you have a responsibility to the society. You have a responsibility to protect the society, to deal with the health problems of the society, and that is part of your obligation still as a nurse. Then, class, so it is established order of things has to be upset before much progress can be made. So take note that there are conditions that are not right in regards to nursing, which should be worked till better conditions are assured. So for example, class, now in the private setting, nurses are most unequally distributed, and patients who sadly need their skills are unable to secure it. So nurses who seriously need word are held back from accepting calls to nurses where their help is sorely needed. So what's the message of this paragraph that I pasted there, class? The purpose of that is to remind you that not all the time as nurses you will be in an ideal situation. But since you are having social ethics, the way you deal with the society, guys, you need to be able to deliver to the society. Okay, for example, no, you lack medications. Okay, if you lack medications, class, you need still to give medications to as much patients as they can be given. Okay, you do not stop doing it because it's lacking, but instead you make use of whatever is available for the greater good of your patients. So again, as mentioned there, you should not be upset, class, but that sometimes there is something lacking or sometimes little progress can be made because these are your responsibilities to the society. And then class, nurses should have a pioneering spirit and to pioneer nursing service beyond the established order of things. So it is not our responsibility to complain. It is not our responsibility, class, to stop working if ever we do not want the work. Instead, as nurses, we should do our best to give the care that our patient would deserve. Okay, that will be the end of our discussion for today, unless if you have any other questions.